Hi, welcome back to my channel. Today we are going to discuss another cause of female infertility, disturbances in thyroid disorders. Mostly hypothyroidism and hyperthyroidism are the two common affections in thyroid gland, which in turn affects metabolism in human. Especially today I am going to discuss about hypothyroidism and its role in the female infertility. How this hypothyroid, deficiency in thyroid hormones affecting the fertility in female is what we are going to discuss today. The cause of hypothyroidism is generally autoimmune, but mostly Hashimoto's thyroiditis is the common cause for hypothyroidism. What do you mean by hypothyroidism? Decreased thyroid hormones T3 and T4 are deficient. That is low level of T3 and T4, triiodothyrin and thyroxine level. Because of this low level, the TSH level is high. The TSH level will be higher when the T3 and T4 levels are low. This state is hypothyroidism. How it affects the fertility rate in female? Because these thyroid hormones are essential for the fertilization and implantation and also the placentation. So how to prevent this with the help of homeopathic medicines is what the communication through this channel. In the ovaries, actually thyroxine hormone plays a vital role in the maturation of follicles, in folliculogenesis and ovulation, and also formation of corpus luteum. This corpus luteum is a group of cells left behind ovulation which helps to prepare the endometrium as a bed to welcome the fertilized egg to come and attach with the endometrium. It's actually preparation of bed, and also release of progesterone helps to a greater level for the preparation of this bed in the endometrium. So this facilitates healthy implantation of the fertilized ovum. Then to sustain the pregnancy also by or with the help of release of progesterone hormone. Common symptoms of hypothyroidism are weight gain or obesity, constipation, irregular menstrual cycle, and muscle soreness and fatigueness, profound weakness and tiredness. So these are all the common symptoms in hypothyroidism. Nowadays it's quite common even in the school children also. I would like to communicate the mild symptoms in the state of hypothyroidism also, because this is very, very important in the homeopathic perspective to select the well indicated remedy and to treat the hypothyroidism patient without the supplement of levothyroxine and establish the normal functioning of thyroid gland. The major mind symptoms are depression, weak memory or forgetfulness, inability to fix attention, that is attention deficiency or difficulty in concentration, and depression with or without probable cause. So these symptoms are to be considered to study the mind symptom of the individual in addition to the physical symptoms explained by the individuals when we are taking the case. How homeopathic medicines are used without levothyroxine supplement and how it helps to make the thyroid gland to retain its function regularly. Low thyroid hormones in turn increases the prolactin secretion. So increased prolactin or hyperprolactinemia may result in anovulated menstrual cycle or delayed menses, sometimes amenorrhea for months together, and it may affect the ovulation also. So by regulating the normal range or optimum range of thyroid hormones, this hyperprolactinemia can be controlled and ovulation could be enhanced. So how the homeo medicines are helpful? So depending upon the mind symptoms as well as the physical symptoms, we can select the following remedies depending upon the individualization of the case. So Calcarea carb usually helps to a greater extent in correcting the thyroid diseases, and also it helps to control the obesity. Natrum muriaticum is a wonderful homeopathic medicine in treating depression. Thallium metallicum, which helps to regulate the thyroid gland function, as well as adrenal also to control the stress and also the inability to fix the attention. All these could be treated with the help of Thallium metallicum. Kali carbonicum, sepia and silesia also helping to a greater extent in regulating the menstrual cycle by correcting the mind symptoms. Especially Cayalvizhi is an medicine which acts on the immune system and regulating the immune mechanism also. So the autoimmune disease could be corrected with infrequent dose of Cayalvizhi also. During the treatment, in addition to the constitutional medicines, we may use mother tinctures such as fucus and badiaga, which helps for treating the muscle soreness, fatigueness of the muscles and sluggishness in their activities, and the muscle cramps especially noted in the calves and also during sleep in hypothyroidism patient. So these medicines are helping to a greater extent by regulating the thyroid function and by inducing the thyroid gland to secrete its hormones, that is T3 and T4, which in turn give fantastic cure in hypothyroidism and correct the fertility also. Hope this video would be helpful in understanding about hypothyroidism and how it affects the fertility and how it could be treated. Thank you. Stay tuned with us.